Hello guys, welcome back to my YouTube channel. From this video, I will discuss about the celiac trunk and its branches. The celiac trunk is a branch of abdominal aorta. Actually, the abdominal aorta gives origin to three unpaired arteries for the supply of the derivatives of foregut, midgut and hindgut. Celiac trunk is the artery of foregut and the superior mesenteric artery is the artery of midgut and the inferior mesenteric artery is the artery of hindgut. So you can see this is the abdominal aorta. You can see the abdominal aorta starting at the level of T12 and it goes downwards and divides into two main branches as common iliac arteries. So the three unpaired, that means only one artery, three unpaired arteries are the celiac trunk. You can see here is the celiac trunk and here is the superior mesenteric artery. Here is the superior mesenteric artery and here is the inferior mesenteric artery. So the celiac trunk is situated or located at the level of T12 and the superior mesenteric artery is located at L1 and inferior mesenteric artery is located at L3 level. From this video, I will discuss only about the celiac trunk and its branches. From my next videos, I will discuss about the superior mesenteric artery and inferior mesenteric artery. In this picture, you can see the celiac trunk and the three main branches which origin from the celiac trunk. Celiac trunk is a very short artery, about 1 centimeter long, as it immediately divides into left gastric artery, common hepatic artery and splenic artery. This is the left gastric artery, first branch, then the splenic artery and the common hepatic artery. Those are the three main branches of the celiac trunk. And then the celiac trunk is surrounded by celiac plexus of nerves as well. First we will see what is left gastric artery. Here, look at this diagram and you can see the left gastric artery very nicely. And left gastric artery at first, it runs upwards. You can see it runs upwards and then to the left, behind the parietal peritoneum, to the cardiac end of the stomach. This is the cardiac end of the stomach. So it goes upwards and then to the left, behind the parietal peritoneum, towards the cardiac end of the stomach. And then it enters into the left end of the lesser omentum. You know now the lesser omentum is the peritoneal fold attached to the lesser curvature and to the liver. So the lesser omentum is in this area. So the left gastric artery enters into the left end of the lesser omentum. Before entering the lesser omentum, it gives off esophageal branches. These are the esophageal branches. And then the branches to the lower end of these esophageal branches to the lower end of the esophagus, and in the inside of the lesser omentum, it anastomoses with the right gastric artery along the lesser curvature of the stomach. Here you can see this is the right gastric artery. This is the right gastric artery. Right gastric artery is a branch of common hepatic artery. Here is the common hepatic artery. So, left gastric artery anastomoses with the right gastric artery along the lesser curvature of the stomach. Then, we'll see the course of the common hepatic artery. Common hepatic artery passes at first to the right. Here is the right side, towards the right, behind the parietal peritoneum. And then, first it gives origin to the right gastric artery. First it gives origin to the right gastric artery and then to the gastroduodenal artery. Here the picture is not accurate with the description. Some pictures are like that. They are not accurate with the description. So, but you have to remember the common hepatic artery first gives origin to the right gastric artery and then to the gastroduodenal artery. This diagram is tally with the description. Here you can see the common hepatic artery. It first gives the right gastric artery and then gastroduodenal artery. Now you know right gastric artery anastomose with the left gastric artery along the lesser curvature of the stomach inside the lesser omentum. Then the gastroduodenal artery. This is the gastroduodenal artery, and it artery descends posterior to the first part of the duodenum. You can see it descends posterior to the first part of the duodenum and divides into right gastroepiploic and superior pancreaticoduodenal artery. I told you the gastroduodenal artery divides into two main branches as superior pancreaticoduodenal artery and right gastroepiploic artery. The superior pancreaticoduodenal artery, uh, no, the right gastroepiploic artery is also known as the right gastroomental artery. Actually, the right gastroepiploic artery goes towards the left side along the greater curvature of the stomach to be anastomosed with the left gastroepiploic artery. That means left gastroomental artery in the greater omentum. The superior pancreaticoduodenal arteries are two in number, anterior and posterior, and they course along the junction of the pancreatic head and second part of the duodenum to anastomose with the corresponding branches of the inferior pancreaticoduodenal artery. You can see here the superior pancreaticoduodenal artery, the posterior branch, and then you can see the anterior inferior branch, then posterior inferior branch, then here the anterior superior pancreaticoduodenal artery. As the name given for the artery, it supplies to the pancreas and the duodenum. Pancreaticoduodenal means it supplies pancreas and the duodenum. Here this diagram is very simple. You can see the gastroduodenal artery coming down, and then it divides into two branches as right gastroomental artery or the right gastroepiploic artery and superior pancreaticoduodenal artery. Then this superior pancreaticoduodenal artery again divides into two as anterior superior pancreaticoduodenal artery, which goes anterior to the pancreas, and then the other branch is posterior superior pancreaticoduodenal artery, which goes in the posterior aspect. After giving the two main branches, the right gastric artery and the gastroduodenal artery, the common hepatic artery continues as hepatic artery proper. This is the common hepatic artery. After giving right gastric artery and the gastroduodenal artery, it continues as the hepatic artery proper and goes towards the liver. Actually, this hepatic artery proper ascends in the free margin of the lesser omentum along with the common bile duct and portal vein. In my previous video, I showed you what is the epiploic foramen is and what are the anterior relations of the epiploic foramen. They are in the free margin of the lesser omentum. There are three structures in the free margin of the lesser omentum as bile duct, hepatic artery proper and the portal vein. Those are the three anterior relations. So this hepatic artery proper ascends towards the liver in the free margin of the lesser omentum. Then this artery divides very close to the porta hepatis in the liver to right and left hepatic branches like this. It ascends and then divides into left hepatic artery and right hepatic artery close to the porta hepatis. And then cystic artery usually arises from the right branch of the hepatic artery. Imagine this is the right hepatic artery. Then cystic artery arises from the right hepatic artery. Cystic artery. Then the right hepatic artery and the left hepatic artery enters the porta hepatis to supply corresponding lobes of the liver. Now you know about the left gastric artery and the common hepatic artery, the two branches of the celiac trunk. Then the third branch is the splenic artery. The splenic artery, this is the splenic artery, and it is the largest branch. You have to remember that it is the largest branch of celiac trunk. You can see it has a tortuous course. Like this, it has a tortuous course. Here you can see the splenic artery goes towards the spleen. Here also you can see it has a tortuous course because it allows for the expansion of the stomach, as the artery is one of the constituents of the stomach bed. And the splenic artery runs retroperitoneally towards the left along the superior margin of the pancreas. After reaching the front of the left kidney, it enters into the lienorenal ligament along with the tail of the pancreas, and then it supplies or gives off several pancreatic branches as well. Then it further goes towards the left and enters into the spleen by giving a few short gastric arteries and not short gastric arteries. It enters to the spleen by giving splenic arteries. Before that, it also gives the short gastric artery. Here you can see the short gastric artery, and also left gastroepiploic artery. Left gastroepiploic artery means left gastroomental artery. So what are the branches of splenic artery? Mainly it gives branches to the pancreas, and then it divides into left gastroepiploic artery and short gastric artery to the stomach, and also it gives off splenic arteries towards the spleen. So the splenic artery supplies to the pancreas, to the stomach, as well as to the spleen. As a summary, celiac trunk is an unpaired branch of the abdominal aorta, which supplies the foregut. There are three main branches of the celiac trunk, as left gastric artery, splenic artery, and the common hepatic artery. Left gastric artery goes in the lesser curvature of the stomach, anastomose with the right gastric artery coming from the right side. Then the common hepatic artery goes towards the right side and divides into two main branches as right gastric artery and gastroduodenal artery, and further continues as hepatic artery proper, and then divides into right hepatic artery and left hepatic artery and supplies to the liver. Then the splenic artery has the tortuous course behind the stomach in the stomach bed, and it supplies it gives branches to the pancreas, and also it gives branch as left gastroomental or left gastroepiploic artery to anastomose with the right gastroepiploic artery in the greater curvature of the stomach, and gives off splenic branches as well as short gastric arteries. That's all about the celiac trunk and the branches. Hope you clearly understood about the blood supply of the foregut structures. Thank you for watching. If you like this video, please subscribe into my channel for more videos, and put a like and a comment in the comment section. Thank you for watching.